Well, good afternoon, good morning, good evening, and wherever the heck you are. I am Dr. Christopher Vogelmann, along with the lovely, talented Monika Klein, nutritionist to the stars.
Hello, welcome. And hello to my punny friend,
Where are they?
Christopher.
Are your punny friend?
My punny friend. He takes all the puns away. I never get an opportunity.
You can pun. You feel free. Pun amongst yourselves. The voices.
Yeah. So today we're going to be talking about food choices, food availability, and how to be a little more economical in your food shopping experience. So I brought with me my friend.
Who is your friend? What's the name of your friend?
Big Chewy, butternut squash.
Big Chewy? Is that a Star Wars reference or no?
No, it says Big Chewy.
Oh, it says Big Chewy on there. Okay.
It actually comes from, interesting, it comes from Arizona. I would have thought it came from locally here in California, but it doesn't. So we're going to talk about like what kind of foods. We talked a little bit about that last week on Wednesday, I guess it was.
Last week, 2 days ago.
It seems like last week, and every day melds into another. And you know what I'm going to do today? I am going to get in my car and start it.
Wow.
I'm going to start it and drive around the block. I don't even know what's going on out there. All I know is I'm connected to people via phone, via social media, via, caregivers coming in and out.
Yeah, but I would suggest to you when you drive your car, just don't go around the block. You need to go about maybe 10, 15 minutes, get it up to like 50 miles an hour, or your engine will freeze and bad things will happen.
Oh, really?
Yeah. You need to it needs a little exercise, just like we need to move all of our joints.
I was thinking of doing that and, certainly wearing my mask and everything in case I want to get out and walk. But I mean, this is such a great walking area I live in already. And that's a problem too, because there's a lot of people walking around here.
Everybody's out at the same time. Yeah.
It's right on a lake. And, this has always been a walking area, even when I was living down the road a little bit. So anyway, I think I'll report back next week.
But you're not planning on walking on water?
No, I haven't asked for that. I haven't prayed for that yet, but
that's above your pay grade.
Good food like this maybe can help you be strong. And I don't know about walking on water, but it's definitely strong. How do you do this? How do you cook a butternut squash?
How do you?
You can slice it open and bake it in the oven, and 350 for about, I don't know, half an hour. You can add some butter halfway through. Actually, you can add a little bit of butter, maybe not halfway through, but maybe 30. I don't know. Like if you have 10 minutes left or 5 minutes left, you could add some butter because that's always nice. Although I never use butter with my butternut squash because it's a butternut squash.
It's got the name butter in it already.
I often will steam it.
Yeah.
In my my basket, my vegetable basket steamer, or I'll roast it in the roaster when I make a roast, whether it's chicken, whether it's roast beef or whatever. I use my roaster for a lot of things. So this is an exceptionally wonderful food. And, there's different kinds of butter. There's different kinds of squashes, spaghetti squash, zucchini, of course, which is not a starchy vegetable. It's got a lot more water content. So you want to, I should pull it back a little bit. So you want to not cook it like that. You can certainly grill it. And I'm not sure if people are using their barbecues, but it's probably a good idea to be doing that. And we can do that here. And I remember when I lived in Winnipeg, we were barbecuing in the middle of winter in the garage.
Oh, I would be a little concerned if carbon monoxide.
With the door open.
With the door open.
Yeah, with the door open, yeah. Okay. So it was a little bit of coverage, so the fumes went out. I didn't do it. This was a boyfriend that I had at the time, and he did that. And it always tasted delicious. So baked potatoes and steak at that point. I'm not a big steak eater. I just don't eat that much beef.
Right.
This is another staple. Let's see. Another staple.
You can't get it at Staples though.
No, you can't.
No.
Guess what it is? It's a red onion.
It. Oh, it is a red onion. It's a lighting thing. I'm having trouble seeing.
A lighting thing. Let's try this lighting. Does this help?
Oh yeah. Now you can see it's red.
Okay, it's red. It's red. So onions.
I like onions.
Yams.
Onions, yams.
Another great starchy food. Onions. What do you use onions for, Christopher?
For making me cry before a broadcast where I have to pretend to be sad.
I use onions all the time and garlic. These are so good for your immune system. Yes. These two items. I think we have a
lot of soups where onions are featured in stews and things like that.
Another thing I forgot to mention about Big Chewy soup.
Big Chewy. Soup. Chewy. I'm going to start a hashtag, save Big Chewy.
Well, no, eat.
Oh, eat Big Chewy.
Nourish your body and soul with Big Chewy.
Big Chewy's back in town.
Big Chewy's back in town. Vital immune enhancing foods. Vital. So
do you have the beta carotenes in there with the Big Chewy or C or what's the?
I don't have any carrots. Are you referring to carrots? Well,
no, carotene.
Yeah, but are you referring to a food item that has?
I was just thinking. I was wondering if Big Chewy contains some beta carotene since it's got an orangey color too.
Probably, and all orange foods do. Yams, lemons, and oranges. This is very, very enhancing for your immune system as well. And I keep mentioning that I have a lemon tree. I believe, since I haven't been out, but I believe I have a lemon tree.
You believe it's still there? Hopefully, it's still there.
And then apples.
Yeah.
The apple a day keeps the virus away.
Oh, keeps the doctor away.
Keep the doctor away and the virus away, right?
Yeah.
So, I mean, this is very, very. I won't say haphazard, but this is just things I wanted to bring in. They're accessible. They're not expensive. These are food items that are not expensive. Yep. Everything that I just showed you can be mixed together and provide a lovely meal. So you don't have to.
Just sprinkle a little lemon juice on top of Big Chewy and enjoy.
Put it in your pot and just add water and voila.
Voila.
This is my cooking class today.
This is Monica. Meals with Monica.
We're not doing cooking classes today. We're talking about ingredients. We're talking about groceries, ingredients, things that are very simple and should always be in your kitchen.
So you found that the availability of Big Chewy, the yam, the red onion, and the lemon the availability is pretty good where you are?
Pretty good. Yeah, okay. Everything. I mean, I have been having people shop for us, and there's really nothing that's on my shopping list that I can't get.
Okay.
Again, we talked about that the other day, and there's more availability now than there was, 3 weeks ago, 4 weeks ago.
Well, I think that's important because a lot of people have the notion that the shelves are just as empty as they were last month, and that's just not true.
That's not true. That's not true. And of course, there's still lineups. Yeah. And again, I'm relying on outside reporters for all of this.
Right.
And outside sources. But, I am in touch with lots of people that are going out for shopping, specifically for shopping, grocery shoppings. Yeah.
I'm just realizing our video feed today, I feel a little herky-jerky. There must be something going on.
Oh,
I must have a bunch of video gamers next door today, whereas in the past you've had them. So.
I don't have video gamers. This is not a very video gamer. I mean, I'm assuming. I don't know.
It's a Netflix neighborhood. Maybe.
I'm assuming. By the way, it's what is it? Formal Friday. I wore earrings today.
I wore a collared shirt instead of a t-shirt.
I wore a scarf.
I really, next time, if we do a Formal Friday thing again next week, I'm going to wear a tie just because I want to see if I still remember how to tie one.
That's a good idea. I'll just,
mind you, at 2:00, we are 2:00 Pacific, 5 Eastern. John and I are doing our little marketing happy hour.
You could do the tie.
Yeah, well, no, I'm going to tie one on, which is a little different.
Yeah, it's pre Friday, but again, who knows what day it is anymore? You know, who knows?
And I will tell you, from what I remember, any day above ground is a good day.
Yeah, I think so.
Yeah,
I think so. Yeah.
So what about, so when you order
6 feet under, right? That's what we talk
about. Yeah, exactly.
About.
6 feet apart, not 6 feet under.
Yeah.
So when you talk about availability and food choices, I mean, so you particularly went after sort of like the starchy vegetables with the yams and the big chewy. What's the rationale behind that?
No, not necessarily. You have to have a balance of both. I have broccoli and asparagus. I didn't bring them from upstairs, but I have broccoli, asparagus. I have cauliflower as well downstairs, and of course, the onions are not starchy, but the squash and the yams and the beets, which I shared a few days ago. This is an interesting thing about beets. I don't know. I have met people that have never eaten beets or have never prepared beets, which I find unusual because I grew up with beets, just like sauerkraut, beets, sour, like a lot of these vegetables I grew up with.
Yeah.
And, but a couple of years ago, 2 or 3 years ago, I used to peel the beets before I boil them.
Yeah.
And she was actually a nurse, my husband's nurse, and she said, boil them till they're
then peel them.
And then peel them in cold, like soak them in cold water for like a minute or so. And they just peel off so beautifully.
Yeah, because you get that outer layer, you get the separation of the outer layer. Yeah.
And that outer layer is really, really tough. You have to get it off in order to digest it, in order to break it down. So easy. You can make, just eat it as is, or make a wonderful beet salad with goat cheese, a little bit of lemon. Here's the lemon coming into play, and a little bit of dash of salt, a little bit of pepper. Voila, so refreshing.
And don't forget borscht. Borscht.
And borscht, yeah. I grew up with borscht.
Soup.
Did you grow up with borscht?
No.
Yeah, I grew up.
But I learned later in life to appreciate borscht. Borscht was not necessarily beets. It was any vegetable soup was considered borscht. So.
Well, our borscht was beets, and traditionally borscht is beets. And I didn't have borscht for a long time. And then my husband's, he was like, when he was cooking, when he was, able, he was really, he's just an exceptional, gifted cook. I mean, he just flavors things, layers things. They were always so delicious. So he used to make borscht. And he loved making soups. And now, unfortunately, he can't have soups because he has a swallowing issue. He has a autoimmune disease, which causes some swallowing issues. So he just eats pureed food now. So, and that's unfortunate because two things he loved to do. He loved to cook and he loved to eat. Two things he absolutely
those are the limitations that kind of affect our mojo. It's like when my dad had been a chiropractor for 62 years, and when he could no longer practice at age 87, he lost his mojo. And then when my mom passed away, he lost two things he wanted to do, which is one, take care of my mom, and then two, take care of the patients. And when both of those disappeared, that did have an effect on his psychology for sure.
Well, yeah. I mean, I'm not saying that my husband isn't eating. He still has a really good appetite, and he does eat things. And we, as I may have mentioned, we are still adding things to his Meals on Wheels. He is getting Meals on Wheels. And that's another thing I wanted to talk to you about. Is the Meals on Wheels for seniors is definitely an option for people who are, compromised. And that's, of course, national, probably international, I think. And there's another thing here called Angel Food Project. And also I just read something about another food source for people who are struggling. And certainly the schools, a lot of the children were relying on the school meals. So I think they're still implementing that as an option for, feeding kids. So, we're looking at the full gamut of accessibility for everyone, food accessibility.
Mm-hmm. Well, there are reports of farmers having to plow under some of their produce because the distribution channels have been disrupted. And
what do you mean? What do you mean by that?
Squash and Big Chewy and some of these others, and yellow squash and others. I've been watching today, seeing a lot of them being plowed under in the fields because they can't find the people either A, to pick them, or they can't find the trucks to be able to haul them away.
That is a shame.
But that's a reality because so many people are sick within the distribution channel.
Well, here's an option that might be, I mean, there's a lot of employment in grocery stores and delivery services. And I'm not sure. See, this, I've never heard this report. Is this a new report?
This has been going on for a number of weeks now, but it was just, there's more video and more reports available to show how some of the farmers actually have had to plow under their crops because they have not been able to get them taken away. And the farmers would prefer to have people eat the food. And many of them are willing to even give it away. But if you don't have the people to transport the produce, then the produce just rots, and it's better.
This might be a good option for people who are not working. I don't know if there's a tendency. I'm going to collect unemployment, so why bother working? I don't wonder if that's a tendency with people.
I'm not certain about that, because you have to understand that most of the workers who pick produce and pack and meat plants and all kinds of places, I mean, unfortunately, many of them are not eligible for unemployment insurance. If you catch my drift,
people who have lost employment in other areas.
But then you have to travel to the rural areas to do that work, and I think there's not as great an incentive either, because the pay for that work is very low.
Well, I mean, there's so many economic factors. There's so many factors influencing people. But what a shame. Well,
it's just the reality, and that will change in the months to come. But there is a significant disruption.
There will be a food shortage as well because of this.
But there also you have to consider that there's plenty of packaged, overly processed food available. That's the problem. Yeah.
That is the problem. And I was just going to say that, because we can't live on that stuff for very long, or we can't be healthy on that stuff for very long.
Man does not live by Oreos alone.
Oreos, anything, yeah.
You got to have the milk to dip your Oreo.
Cheez-Its or anything. I mean, Cheez-Its. Cheez-Its or all those other things. Yeah, so it's there have got to be ways that we can resolve that issue, and I'm sure many people are trying to figure that out. But
it's a matter of coordination and cooperation, and there's been some disruption in markets in general, and I'm not talking about the supermarket, but that's too. But it just in terms of the general, you got to think distribution. So the ability to transport fresh produce, distribute it, store it, all of those things are critical factors. And if you have workers, whether it's grocery store workers, truckers, farmers, or the people who are picking the food, if they become ill, that shrinking of the labor force means that food is less available.
Yeah, I mean, that's basic economics we're talking about.
Supply and demand.
Yeah, exactly. So, I mean, it's all tragic. But again, even though it may appear to be tragic, the reality is that it presents opportunities for people. It presents opportunities for people to eat better at home. It presents opportunities for folks to not have to necessarily travel to the grocery store, spend the time, the energy, the gasoline, and everything else like that, going in, going out, standing in checkout lines and others. I think some people will get to the point where even once a lot of this crisis, or I would say sort of the pandemic disruption starts to disappear, I think there'll be a lot of people who are still going to prefer to have their food delivered. Delivered and cooking at home and eating
at home. Yeah, because I don't see restaurants coming back anytime soon, and if they do, they're going to have half the tables that they used to.
Yeah,
and there's going to be distancing. You may have to use an app, or you may have to have your temperature taken before you walk into the restaurant.
Yeah, they're talking about that, but I don't think it's going to be a plethora of openings anytime soon. And
but I do think that cooking food and knowing what your ingredients are and using high quality ingredients, you may actually find a lot of people are going to get healthier, providing they're making the right choices in the produce.
This is yes, absolutely. And I was looking at this report about what types of businesses sort of came back during the recession that were really big
you
during the
froze for a
recession
second.
of 2008, 9, 10, 11, 12. Am I still there?
You're still there. You froze for a moment and had me very worried.
Okay.
I don't know whose Wi-Fi. I think we both have Wi-Fi.
I wasn't even talking about frozen vegetables, so yet.
Frozen vegetables. Talk frozen.
But yeah, during the recession, what types of businesses and industries were thriving or potentially thriving in a recession time? And but we can compare to some extent, but we can't really compare because this is also a health crisis, whereas 2008-9 was not.
You're gonna see a lot more parallels to 1918 than you are to 2008. So.
Yeah, in some ways, but we're in some ways, of course, because it was also a health pandemic. But technologically, we're different, and so many ways we're so different, and we're closer to what happened in 2008. Because along with the economic crisis, we will have the health. We're having the health crisis, but that's not going to go away that quickly. So things like cooking, organic food, good healthy cooking, health focus, really a lot of health focus, and not seeing it as a luxury, but really as a necessity so we can stay strong.
Well, and there's also the notion that cheap food is something that has a high cost when it comes to health.
Yeah, cheap. And you know what? A lot of these foods I just showed you, they're not expensive. They're not expensive. Will they be more expensive because of this problem that we're speaking about, because of the farming?
I mean, temporarily. You're talking a matter of, several weeks to a few months, but as time goes by, the distribution channels themselves begin to heal because workers and drivers and others have gotten better.
Of course, yes. So, no, the cost of real food is less than the cost of packaged foods. You're just having to spend so much more money to get the same satisfaction, and it's usually not true healthy satisfaction, or satiety as we call it in nutrition. It's just filling up your taste buds. Really, it's not really nourishing your body. These foods.
Well, there is. I understand that. I mean, I was talking about more like optimal nourishment. I mean, if all you have is a box of mac and cheese, and your delivery hasn't come yet, you better eat that box of mac and cheese.
Well, you have to eat something, right?
Exactly. I mean, so we're talking about sustaining life, but I think and it's the thing we talked about last time too, which was fresh, organic, number one. Under that is conventional. Then comes maybe frozen organic, actually frozen organic might be right under organic. And then you start working your way down to canned.
Yeah. Still, if you have that mac and cheese in your cupboard, in general, you want to focus on healthy, fresh. And that's all I'm saying. I'm not saying don't eat because it's mac and cheese. Don't eat because, it will sustain you to some extent. It'll give you some calories, some nutrition, some amount of nutrition, but it's not, most of your diet shouldn't be that, of course.
So I shouldn't stock my cupboard with Oreos, mac and cheese, Twizzlers.
Sure, if you want to be sick.
About stovetop.
I shouldn't laugh, but, and it might not show up now.
Yeah,
that's the problem. It might not show up now, but it's not building.
Well, no, and it is cumulative. It is definitely a cumulative effect. Now we've made a very deliberate attempt here to get as many fresh vegetables as possible, in part because we like to do our green smoothies and juicing and stuff, and we've done it far more regularly now than we did previously. And I think one important thing to consider, it's a question of time. because convenience foods.
We have a lot more time now, though.
We've got a lot more time, so we actually can spend the time to cook.
Yeah.
And a lot of these things that you talk about, it may be, are you willing to invest 30 minutes in cooking? Are you willing to invest 45 minutes in the oven while you walk away and do other things, as opposed to doing drive-thrus?
Well, here's a whole new educational opportunity to actually start really getting back to the basics. Mm-hmm. Getting back to the basics. You have time. You have time to look at videos about how to cook, what to cook. It's an immense opportunity to really relearn this, because this is really what.
I did not mean to do that. I still didn't mean to do that. I was trying to load up the comment section, and that was the wrong button.
So it's just an opportunity for us to really learn how to do this, because we do have time, and we are at home, and we are allowed to go and get groceries. So it's like 1 + 1 + 1 = 3, and good for me and you. 3 and a meal for me.
Are you waxing poetic on a Friday afternoon?
Yeah, I guess. I mean, I do write poetry, by the way, but most of my poetry.
Have you written any poems about Big Chewy?
I should. Big Chewy.
Oh, Big Chewy, you're so rich and gooey. I put butter in its place and feed you into my face.
There you go.
So,
dear Big Chewy,
dear Big Chewy,
I love you today, and I will love you today all the way.
Oh boy! All right. So, well, you work on that poem for next time.
Yes. Yes. I usually have to write up my poems. I don't like speak them out. I write them very quickly, and then they seem to.
I go with the speak now or forever hold your poetry.
Yes, I know.
So we're about at the we actually went over what our intention was, so we're approaching the half hour.
Okay. Well, so next time we're going to talk a little bit more about food and health and easy things to do to maintain your health today and hopefully in the future, because we are focusing more on today right now. And today is, challenging, of course. And so we want you to be as healthy as possible. Isn't that right, Christopher?
Yes, indeed. And where can people find you, Monika, if they want to consult with you one-on-one?
I am at Monika with a K, Monika at Coaching for Health. That is CoachingforHealth.com. That's my website. That's where you can reach me. That's my email, actually. But my website is Coaching for Health.
I'm so glad that you didn't put a numeral 4 in there, because that's just a no-no
from our marketing. I was lucky to get FOR, and I've had that domain since 2005. So yeah. That's it for today. Friday, formal Friday, friendly Friday, fantastic Friday, and
fabulous Friday.
Yeah. Feeling good Friday.
Feeling good Friday. So join us. Actually, we're having you back Wednesday of next week.
Wednesday, yes.
And following with a fantastic Food Friday.
Fantastic Food Friday.
A week from today.
Yes. Fantastic Food Friday.
That's it for now. I'm Dr. Christopher Vogelmann.
And we could do Wellness Wednesday.
We could do Wellness Wednesday, and we. Okay. Wellness Wednesday.
Have a good week.
Enjoy.
Good time. Good weekend.
Eat well. Do good work. Stay inside. Stay healthy. See you back.
Bye.